had no idea that I was HIV positive. So it really came as a shock. And of course, the first reaction when something like that happens is you break down. So I did break down, and I discovered that I was virally suppressed in 2014 when I was required to do a viral load test. Because before that, I used to still suffer from opportunistic infections, despite even me being on ARVs. So because my CD4 count was always quite low. So in 2014, at the health center where I go to, they introduced the viral load services, and they required all of us to do our viral load test. So when we did a viral load test, it came out undetectable. So that's when I discovered that I was virally suppressed. I think after discovering that I was virally suppressed, first of all, generally my health seemed to have improved. I haven't actually had any opportunistic infection ever since I was discovered to be virally suppressed. And then also, generally, I've also had a sense of well-being because of that. My relationship with my partner, I think, improved because initially we had those fears of him getting infected. But then when I found out that I was virally suppressed, I knew that the chances of me passing on the virus to him were quite slim because the virus in my body was very suppressed.
Today, I am launching the undetectable, equal, and transmissible You Equal You campaign. The You Equal You campaign epitomizes the importance of people on antiretroviral therapy attaining viral suppression, which not only helps in fighting the virus in the body, but also helps in reducing the chance of transmitting the virus to someone else.
On behalf of the U.S. government, I'm honored to join you today to mark this important occasion of the 2019 National Health Week.
Just tell us how important this campaign is.
I think it's an exceptionally important campaign because it better describes to people how the virus works. So it means undetectable equals untransmittable. With one member positive and one member negative of the family, as long as the positive member takes their medicines regularly and gets to the point where their level of HIV is undetectable, they can no longer transmit the virus to their family members. And it's going to be critical as we move forward in Zambia and other places here in Africa with high HIV rates, because people are going to realize that they can have normal, regular lives by taking medicine. 15 or 20 years ago, that we didn't want to talk about HIV, but now that it's a manageable disease that we can live until we're old with, it's important that we talk about it, that our families know about it, that we remove the stigma from it. Many people have done absolutely nothing wrong, yet have wound up with the virus. So once you test positive, it's critical that you get on medicine immediately. And within as little as 2 weeks, we can get individuals to viral load suppression, which means they're now at that undetectable level, which means untransmittable.
I would like to start off by saying when someone gets infected with the virus, so the virus gets inside the blood, it starts circulating, some of it is circulating in the blood, and some of it hides in different tissues of the body. Now, the one that's circulating in the blood, it finds the immune cells, what we call CD4 cells. They get inside, replicate themselves, so it turns the cells into a little factory to make more viruses. and then they destroy the cells, little viruses are coming out, and they attack more CD4 cells, and they do the same thing, and that's why the CD4 cells drop, and then someone becomes sick because their immune system is not able to defend them against diseases. So this medicine, what it does is that as soon as you take it, as soon as you start taking it, it works very well. It can bring down the number of viruses circulating in your blood to levels undetectable within a very short period of time. Usually within 2 to 3 weeks, the virus is undetected, which means it's not destroying immune cells anymore, and your body now can produce immune cells that can defend you from other infections.
So previously, we've all known about CD4 count, but now what you're telling us is that we need to pay more attention to the viral load. Why is that?
So it makes sense, right? Like I just explained, if there are not enough viruses circulating, so there's nothing attacking the immune cells, there's nothing attacking CD4 cells. And the goal is to prevent viruses from circulating, because if they're not circulating, your CD4 cells are protected. And if your CD4 cells are protected, your body's protected. So that's why we're focusing more now on viral load. And also another thing that we learned over the last few years is that when the virus is undetected, the viral load is undetected, the undetectable, we have found that the risk of transmitting HIV, it's pretty much zero. And that's why we're encouraging people now to come forward, be tested, take their medicines on a regular basis so they don't get sick and so they don't transmit HIV to their uninfected partners. But I should mention, this depends on them taking their medicines on a regular basis. I mentioned earlier that when they get infected, some of the virus hide in different parts of the body. They stay dormant. When they come out from the hiding, if you don't have enough levels of drug in your body, they'll start producing again and they can destroy more CD4 cells and you can infect your partner. But as long as you take your medicines, when the virus comes out of the hiding place, you have enough medicine to destroy it immediately. And that way you will not get sick and you will not infect your partner. When someone is pregnant, it's important for them to go and get tested for HIV. And if they find out that they have HIV, they need to get on this medicine immediately. And they need to take it on a regular basis, because if they take it on a regular basis, their unborn child will not get infected. And when they give birth, during breastfeeding period, their child will not get infected. So that's why it's really important for everyone to know their status and to get on this medicine, because it saves lives.
Because when one is virally suppressed and they're in a discordant relationship like I am, then the chances of me passing on the virus to my partner are actually zero, from what research has now concluded.
This drug is one pill that you take once a day. And the difference between this one and the one that was there previously is that this one has fewer side effects. So you take it and you feel great. You don't feel sick like some of the other ones that we used to have before. As someone who takes care of patients living with HIV, this is actually very exciting. It's a lot easier to treat HIV now than it is to treat diabetes, for example. It's just like high blood pressure. You take your medicines every day, you're good.
Hello friends, I'm excited to tell you about the U equals U campaign for people that are living with HIV and they're taking antiretroviral drugs. After 6 months of being on these ARVs, we expect the amount of virus in the blood to be undetectable. They have to do an HIV viral load test. So that test will not be able to pick the HIV in blood. Now the good news about it is the fact that once someone reaches that point, then they cannot transmit HIV to their partner sexually. And that is what is untransmittable. It will also make them to live long, healthier lives.
Talk to your healthcare provider for more information on U equals U. U equals U does not prevent transmission of HIV through injecting needles, nor other STIs, or prevent pregnancy. Brought to you by the Ministry of Health, National AIDS Council, and Center for Infectious Disease Research in Zambia, Cidrz, with support from the American people through the United States President's Emergency Plan for AIDS Relief, PEPFAR, and the U.S. Centers for Disease Control and Prevention, CDC.